Hey everybody, what's going on? I'm Joe. I'm here to talk to you guys a little bit more about the 90-90 hip stretch. This is something that we've been getting a lot of questions on in the clinic. And sometimes after your first visit or even after a couple of times of hearing this, it can kind of be a little bit confusing. So I'm going to just shed some light on how to do this the right way at home. First is the position, all right? A good 90-90 position means just that, getting into a good 90-90. So I have my hip pointing straight out, my knee coming down at a 90-degree angle, and then if I draw a straight line from my shoulder, I should intersect my hip and my knee, okay? If you can't get into this position, it's not a big deal, all right? The idea is to focus on your mobility and your movement, okay? Not what myself or Vakash or Joe can do, okay? So if you can't get into this position without using your hands, you can always use both hands, okay? You can open up a little bit more and use one hand here, all right? If you find that your knees or feet are having a hard time maintaining contact with the floor, also not a big deal. Just take the floor to you with a towel, with a pillow, tuck that right underneath there, okay? We just want to make sure that we have all these points of contact with the floor, okay? Once we find a nice comfortable position, whatever that may be for you, the point of this is going to be to start to really bowstring a stretch through your hip, okay? I'm going to start with my lead leg in front, all right? I want to feel this stretch into the deep, deep right buttocks of my hip right now, okay? Nothing into the front, right? You'll hear us talk a lot about closing angle pain and opening angle pain in the clinic, okay? I want to make sure that all that stretches into my butt. So I'm going to use my belly button and reach toward the front part of my knee and take up as much stretch as I can. This is a deep hip stretch. The purpose is to go slow. Once I gather all that tension, I'm going to stay here and I'm just going to breathe for a couple of seconds, right? After I'm done breathing, I make sure I'm not in any pain. What I'm going to do is I'm going to take this whole leg, I'm going to push it through the floor, right? Notice how I'm not moving. This is an isometric contraction. So no movement is occurring. I'm just pressing the entire weight of my leg into the floor, like I'm trying to leave an indent of my leg when I get up, okay? That would be considered your pale contraction or progressive angular isometric. I might do that a couple of times to get access to more motion as I go down toward the floor. Once I get as deep as I can go, and this is going to be different for everyone, that's when we start our rails contraction, or the idea of trying to lift the leg off the floor. So for that, again, I can call on a prop, I can call on a ball, and then now I'm going to try to squeeze a towel, a ball, or anything along those lines, trying to drive my chest to the floor and trying to now unweight my leg off the floor, again, as hard as I can for about 10-20 seconds, and then relax, okay? After you're done with one side, come up nice and slow, okay? Don't springboard out of that, all right? You've now earned the right to go to the back trail leg. Again, lots of options with the back trail leg. I might just open up here, okay? Trying to take this hip and push it forward and go through my pails and rails work. I can also take my same side hand, grab the shin, right hand here, hook it into the hip, okay? And I'm going to go through the same exact thing that I just did here. I'm going to try to push that leg down, create some tension first, hold for 10 seconds. I'm trying to push that leg through the floor. And then as soon as I'm done with that, I'm going to try to lift that leg off the floor, thinking about bringing my armpit and my shin together. Okay, again, these are isometric contractions, so you're not seeing big movement occur, all right? If you have any questions, please leave it in the comments, email us, call the office, bring it up at your next appointment, but don't let your questions go unanswered. Thanks for watching, guys.